No, कुछ भी no. Live है Facebook पे live है नीचे नकल कुछ नहीं.
So I think we are live. So let me start. Hello everyone. My name is Ammar Younas. I am CEO of IMO Innovation Consultants. IMO Innovation Consultants is a boutique digital transformation consultancy. We provide innovative consulting, training, digital skills, networking opportunities, as well as a full suite of skills that helps to unlock the growth potential of individuals, enterprises, state bodies, and educational institutions. We have 4 domains. The first one is IMO Legal Consulting, which is a law firm. The second one is IMO Innovation Lyceum, which is an educational consultancy. IMO Innovation Sea Change, which is a business consultancy. And the last one is IMO Innovation Soft Cottage, which is our software house and IT consultancy. Today we are going to start a new segment, which is called as IMO Talks. The purpose of these talks is to introduce you with our experts, their areas of expertise, and different services which we offer. Another purpose of these talks is to engage students, experts, academicians, enterprises, state bodies, and general public to inspire them, to motivate them, and to seek their feedback. During these IMO talks, we will be discussing social and applied sciences, humanities, different range of subjects, for example, economics, finance, IT, philosophy, and so on. The topic of the first talk is health informatics in the times of pandemic. And for discussion, we have a very special guest with us, Dr. Mohsin Shaikh. Dr. Mohsin, how are you?
I'm doing great, Ammar, and it's pleasure to have you here, and it's wonderful being with you. Thank you very
Pleasure
much.
is all ours. So can you share your slides?
Yeah, sure. Ammar, can you you have disabled my participant sharing? Can you just make some settings? You have disabled my sharing. Host has disabled the participant sharing. Can you just put it on? I can't share the slides. Yeah,
Yes,
that's fine.
now can you share?
Yeah, that's fine. That's great.
Okay.
Okay, so today I'll be talking about the health informatics, and it is going to be the introduction. Now, before we move ahead, I have to introduce myself precisely, but I'll be just going through that later on. This is a very novel subject and novel area, and very, uh, you know, uh, the emerging area of computer science, where it is going to be a very special one, because in today's age, when you have troubles of pandemic, where you have troubles of diseases, this subject is going to be very important. So today I'm just going to introduce a little bit about health informatics. It will be an introductory session basically. So I'm just going to roll over the slides. I hope my background is little more not comfortable, but I'll try my best to make it convenient for you. So I'll be delivering, about 20 minutes talk on what is health informatics basically, and why it is important, and what does health informatics include. See, the health informatics is basically connect the people, technology, data to improve the healthcare outcomes. The basic objective is to improve the healthcare objectives. And what we have to add with it is safety, supporting operational innovations and technology advancement globally. What I just want to say is that health informatics is subject of connecting the social aspect, the health aspect, the population aspect, and technological aspect together, in order to make sure that we have ability to provide the best healthcare services. Now, if we come down to the basic definition of health informatics, then it is basically an interdisciplinary study. It is basically an interdisciplinary study of design, development, adoption of IT-based innovations in healthcare services and delivery, management, and planning. So if you have to actually look at this topic precisely, then we really believe that it is not a a one discipline or one area of science which we have to cover. So it has to be multiple disciplines, the science, the population science, the the information science, the information technology, as well as we have to combine all of them together in order to do what? In order to design, develop, and adopt an IT-based innovation in healthcare services. This is the basic objective. We are supposed to improve, enhance, and make efficient the healthcare services by making sure that our delivery is perfect, by making sure that management is up to the mark, by making sure that our planning is effective enough for the long term to make sure that the health of the people is the foremost and the top priority. Basically, the health informatics deals with the resources, devices, methods required to optimize the acquisition and storage and retrieval and use of the information in the health and biomedicine. So what do you see that when you see these terms, the storage, retrieval, acquisitions, resources, and devices, basically we talk about we basically we think about more like the IT and computer science and software engineering. However, however, we want to integrate all these terms in order to make sure that our information in health and biomedicine is good enough. So basically, it is a tri-circle of certain subject. This is the clinical care at one stage. You have a health system somewhere in your society, and you have information technology. When you combine them all, so this is basically when we talk about the health system, the information technology, it is a computer science. It is all area of the computer science. It includes the software engineering, computer engineering, the people involved in developing, then deploying and integrating, implementing the softwares. And then you have some health systems. See, in every country like Uzbekistan, Pakistan, or anywhere else in the world, you have particular health systems available. These health systems are responsible to provide the healthcare services to the society. And then you have the subjects or concepts like clinical care. Why do we have these healthcare systems? Why do we have these best healthcare systems? Basically, we want to provide the clinical care. And when you combine them all, when you integrate the resources, the innovation of information technology for the clinical care, and to make sure that your health systems are computerized enough, then this subject is basically known as health informatics. So it has three basic aspects. So why health informatics? Why we require health informatics? See, you in the age of information technology, in the age of such a revolution of computer science and software engineering, one has to really accept that uh, this technology can really be used to benefit the medical science as well. So the health informatics is somewhat the synergy of medical science and computer science in order to optimize the health systems or the prevalent clinical care systems. So in combination of all this, you need all this in order to improve your health system. You need all this in order to reduce the cost of health system, in order to make sure that your computer or medical records are computerized enough to make sure that the life of the people is good enough. And when you have this era of in a pandemic, you have a COVID-19 coming in, you have a different other troubles and problems coming in. So these diseases are to be encountered well enough using the healthcare services. So for that, you basically need the computer science and computer application of computer science properly. So this is a general introduction of the health informatics. As I told you, it is a combination of different subjects in order to make sure that uh, we want to provide the best healthcare services to the people or to the society. And it is in a great need today, because today the COVID-19, the coronavirus, the disease of the coronavirus has engulfed the entire world. So we basically need a lot of this in order to help the society. So when we talk about health informatics for the general public, when they think about health informatics, these are the topics basically which are related with the health informatics. The electronic health records. What electronic health records are? Once you have manual records prevalent in your hospitals, you want to computerize them. You have a knowledge management. Basically, you want to manage. You want to make sure that the registration, that there's a complete data available for the patients, so that their history is being properly managed. And then you make use of computer to help you in making decision for a particular disease. That's the decision support. And the telemedicine, for example, you have some expert doctors or medical practitioners in the United States, and they want to serve in somewhere in Uzbekistan or Tashkent. Then through telemedicine they can do that. We have to set certain standards for that. There's the ethics and security for the informatics of health, for the computerization of the health. This is all included in the topic of health informatics basically. So it's for the general public to understand what is health informatics. So this was actually brief introduction of health informatics. I hope, Mr. Ammar, I am clear enough. I apologize for the little bit interruption in my presentation. Also, I apologize for the inconvenience. My
It's okay. It's okay. Thank you very much for the wonderful presentation. Yes. Yes. So we have so many questions from Zoom and from other platforms on which our video is being shared. So the first question is, of course, you didn't introduce yourself. Can you please introduce yourself briefly about your educational background, about your professional background?
Thank you very much, Mr. Ma. My name is Dr. Mohsin Shaikh. I've done my PhD, the Doctor of Philosophy in Software Engineering from South Korea, and the university I did it from it is the Chungwang University, Seoul, South Korea. I did my master's graduation also from the South Korea, and that is from the Hanyang University, and my major was software engineering again. And currently I'm serving as assistant professor in one of the renowned and very reputable university of the Pakistan, that is Qaid-e-Awam University of Engineering and Technology. I'm actually heading a department of computer science in Qaid-e-Awam University of Engineering and Technology. My research area is software engineering, and nowadays I've shifted my focus to the health informatics. So I'm all in your team to go ahead with you to provide this kind of services to the society and people. Thank you.
Okay, thank you very much. Thank you very much. Yes. So the first question I would like to ask you, that when we talk about technologies, we talk about autonomous system, and we have a traditional healthcare management system. So this traditional healthcare management system is working everywhere. It is a full-fledged system. There are experts in this area. So what are the key benefits of applying this health informatics systems? Because previously we have healthcare management system. It is working perfectly fine. So what are the key benefits? Can you please highlight?
Yeah, thank you very much. Actually, this is a very important question to understand the application of the health informatics in today's age. See, basically, when we talk about the third world countries, the biggest problem that we face today is in the hospitals is the mismanagement of records of the patients, which is done basically manually. We don't have to go into the details. It is actually carried out manually. All of the doctors register the patient's information and data manually. uh, Health informatics, basically the key benefit of health informatics is uh, to provide a management information system to the society, so that the data of the patients is properly managed, and it will benefit in turn as well. It has a trickle down effect. It is a trickle down effect that doctors are going to get benefit from the softwares and systems which are implemented. for the healthcare systems. Even patients' records are managed computerized, so they'll be available online. Wherever they'll be going, their data will be available online. So you can have a very good the patients can have their interaction with the doctors and their medical practitioners very comfortably, and their data would be. This will help in diagnosis of the diseases. This will help in treatment of the diseases. This will help to cure the society. This will help to encounter the pandemic like COVID-19. So it has a biggest advantage of computerizing the manual systems. So the key benefit that you're talking with that you're asking about me is the computerization of the manual systems. So it is going to be ultimately a biggest benefit of applying the health informatics.
So basically you are saying that when accessibility will increase, it will be beneficial for both sides, for patients and for the hospital management. Yes.
Absolutely,
Yeah.
absolutely. It is
You
going
also
to.
talked about COVID-19, and now we are passing through a turbulent period of this COVID-19, and I think not only me but other people from our audience would also like to know about in certain ways or tactics or tricks by using these health informatics systems, they can use this system more productively during the period of COVID-19 specifically. We are agree with this notion that we have to do automation, but what are some of the key benefits during these COVID-19 times?
Thank you very much. Actually, we need to actually understand that even today, the health informatics is being applied to counter to counter and to protect to counter and create the measures in order to avoid the COVID-19 or disease of the coronavirus. Basically, when you must have heard about different technique like surveillance systems and in artificial intelligence in order to identify the hot spots of the coronavirus. This is only possible when you have a systems available. So when you have a patient's data of the patients available with you, then you can properly diagnose, then you can properly give a information, then you can properly do the prediction modeling of coronavirus, that to what extent it can grow and in what areas it can go, and how you can apply your protective measures in those areas. For instance, let's talk about the Tashkent. For example, let's say suppose when we talk about one of the area of the Tashkent where you have a coronavirus or COVID-19 hotspot generating and growing. If you apply the artificial intelligence surveillance systems, that data is supposed to be saved into the some of the open source EHRs, open source electronic health record systems, in order to avoid and protect from the issues of the disease. So basically, we are currently doing in America and the United States, they have already been applying the tactics and techniques and some of the practices of health informatics in order to cope with the challenges of the COVID-19.
Yeah, it is very interesting to see your multidisciplinary approach being a computer scientist. So I have a very personal question that is it something in which you were working previously, or this is a new extension to your ongoing research?
Thank you very much. Actually, I'm these days I'm exploring this area. I'm exploring this subject matter very consciously, and we are looking forward to provide the software solutions to the health systems. Right. So there's an area called open source electronic health record systems, and you don't have to do reinvent the wheel. There's a concept of not reinventing the wheel. You have to actually be very much cautious that utilize the prevalent and available resources. Once you have the data of open source available, for example, the open source electronic health record systems are available, and you utilize those electronic health record systems and you integrate the components and patches and modules of the COVID-19. So I'm actually researching this area very consciously and actively these days, and I think I'll be publishing one of the paper very soon in this area as well.
Yes, best of luck. But there is a question right now. Someone has asked that how we can, as a health professionals or the hospital management staff, can benefit from these software solutions which you are providing.
That's a very important question. Basically, they have to contact with the administration first. They have to, they can approach some of the reputable consultants for that. It requires some of the expert approach towards implementation of open source electronic health record systems. See, once you don't have expert with you of IT and software engineering, then medical practitioners cannot do things at their own. They need the support, they need the assistance that we provide, that we are going to provide them. As an IT expert, I would suggest that they can talk to the administration, and they can talk to them and ask them whether it is possible to consult with any of the firm today which is providing these kind of the services, where we can implement and install the electronic health record systems. And by installing these electronic health record systems, then their entire manual operations and activities are computerized, so it is going to benefit them anyway. So the best way possible is to approach some of the experts for that.
Okay, thank you very much. And the last question, since you are talking about experts and you are our lead scientist, if we talk about IMO Innovation Soft Cottage, so can you please elaborate the role of the ongoing research which is going under your thoughtful supervision at IMO Innovation Consultants related to health informatics, or what services we can provide?
Mr. Ammar, thank you very much. Now, here I have to actually tell my viewers that we have a comprehensive strategy and plan to provide a consultancy regarding implementation of health informatics in any of the organization, may it be a government organization or any of the private organization of health system, right? So we are here to provide them the open source solutions. We are here to provide them customized solution. We are here to provide them the solution of their choice. We are here to provide them the solution which is quite compatible with the particular organization. They don't have to approach a big software companies for that. If they approach us, then we have a very able team of that. We actually at AMI consultants, we have a team of the lawyers, medical practitioners, and IT experts. When they do work as a team, they are there to provide you great services. So I am a consultant is a I think to the best of my understanding is one of the the best option for the today's in today's times.
Thank you very much. And it is all because of the brilliant minds who are working with us like you. And I think now it is the time. And thank you very much for your presentation and for answering all the questions. Hopefully we will have some detailed lectures and webinars so that we can highlight some of the key and specific areas related to health informatics for our specialists from Health Informatics Systems. They might be interested. Yes. And thank you very much to the participants who joined us today. And our next IMO talk will be day after tomorrow on 8th of July. And the topic of the next talk will be treasury management in the era of COVID-19. And for that also, we also have a very special guest expert in treasury management, Dr. Davinder Kumar Jain. So thank you very much for